Thank you very
Thank you
much
so
for
much for
coming.
your leadership.
Oh, that's what my daughter is, a Jen. From Jennifer to Jenny to Jen.
Depends on the age, right?
Right. She's going to be down to a J real soon.
Okay, can we please have some attention in the audience? We have business to need to move on to. If you're going to be leaving, I'd ask that you do it in a quiet manner. Otherwise, we're going to proceed to item number 4, SB 999. Pavli, welcome and please proceed.
Yes, thank you very much, Mr. Chairman. First of all, I'd like to start by taking the amendments listed on page 7 of the analysis. These amendments were requested by Kaiser Permanente and clarify that health plan coverage of birth control only applies to products that are prescribed or furnished by in-network providers and dispensed at in-network pharmacies. I'm delighted to have 3 co-sponsors with me today: Planned Parenthood, the California Family Health Council, and Narrow Pro-Choice of America. Senate Bill 999 is an important bill to provide greater access to birth control and reduces the rate of unintended pregnancy in California by simply changing the timing of contraception dispensing. This is a bill simply relating to that subject. Other issues are either already dealt with in law, but it's on timing. Under current law, health insurance companies and plans must limit their coverage of birth control to 1 or 3 months supply, so 30 to 90-day supply. This, because of access to care issues, this practice can lead to unwarranted gaps in birth control used for many women and often result in unintended pregnancy, particularly rural women or women whose hours don't adjust with having to run to the pharmacy or renew prescriptions. It also relates to people who don't have access to transit to run to it. So to provide for more consistent use of birth control, Senate Bill 999 requires health insurers and healthcare service plans to cover up to 12 months of FDA-approved self-administered hormonal contraceptives at one time. This has already been approved in Oregon, Washington, D.C., with several other states already looking at this measure. This dispensing will be allowed under a healthcare provider's prescription or by a pharmacist under protocols now developed by the State Board of Pharmacy. And Senator Hernandez, you authored that bill, and the protocols are completed. I've read through them as part of presenting this bill here today. This measure is very important to quite a few women in my district. I had 200 emails and phone calls during the fall after Oregon had passed the bill. Just recently, Senate Bill 999 received a very positive report from the California Health Benefits Review Panel, talking about the money would be saved on regarding pregnancies, unwanted pregnancies, and fewer abortions, and the list goes on, so avoidable costs. The idea of annual dispensing is not new. Other states are looking at it, but our Family PAC program for low-income women has been successfully providing it for over 2 decades. And our Medi-Cal fee-for-service program has been providing year-round prescriptions for several years. And as of February, it is now required of all managed care plans in the state. So with me today, I have several witnesses. Amy Moya, Vice President of the Public Affairs for the California Family Health Council, and Dr. Jen Russo, Medical Director, Assistant Clinical Professor, Planned Parenthoods and Sanford affiliates in Orange and San Bernardino counties, as well as UC Irvine Health. I have other witnesses here to answer any technical questions you may have.
Before we get started, I just wanted to say that in addition to the amendments described in the analysis in comment number 4, that you're going to agree to the additional amendments which will be added to Business and Profession Codes 4064.5, subsection F3, that states nothing in this subdivision shall be construed to require providers to prescribe, furnish, or dispense 12 months of self-administered hormonal contraceptives at one time.
Yes.
Acceptable. Okay, thank you.
That would be correct, and I've confirmed that with staff. And I should point out, also in this, to make it very clear, it's allowing pharmacists and doctors to prescribe up to 12 months. If they, in their own opinion, think it should be less, 30 days, 90 days, or whatever, or not dispense it at all, that is up to them.
And then with that, please proceed, state your name and your position.
Thank you. Good afternoon.
It's on.
Good afternoon, Mr. Chairman and members of the committee. My name is Amy Moy, and I'm Vice President of Public Affairs at California Family Health Council. We champion and promote quality sexual and reproductive health care for all and administer the federal Title X family planning program here in California that supports the delivery of quality family planning services for over 1 million women, men, and teens each year. CFHC is proud to join Planned Parenthood and NARAL as co-sponsors of SB 999, and we thank Senator Pavley for her leadership on this important issue for women's health. Women across our state with public and private health care coverage need and deserve equal and consistent access to their prescribed birth control method of choice. This common sense legislation will help ensure that women in California get evidence-based contraceptive care regardless of their insurance status. As the senator noted, while SB 999 is a legislative innovation, providing a year's supply of birth control is not new in our state. This has been a long standard of care under the Family PAC program, and recently, women enrolled in Medi-Cal managed care plans can access a year's supply of oral contraceptives at once. While this is great progress with the millions of individuals moving into new coverage options in our state, we can and must do better. All women in California should have access to best practices when it comes to contraception and the ability to safely and effectively reduce their risk for unintended pregnancy. SB 999 recognizes that women lead busy lives, and reducing the unnecessary hurdle of having to return to the pharmacy every 1 to 3 months to get their birth control is an important benefit and can be potentially life-changing for women if birth control is missed or used inconsistently. SB 999 also trusts women to allow them to follow instructions given by their healthcare providers to take and store their medication appropriately. This bill continues California's leadership and commitment to breaking down barriers to reproductive health access and advancing policy solutions that help reduce unintended pregnancies and save state costs along the way. For these reasons, we respectfully request your support.
Good afternoon, Senators. My name is Dr. Jennifer Russo. I'm currently Medical Director of Planned Parenthood of Orange and San Bernardino counties, which is also known as PPOSBC. I'm an obstetrician gynecologist with further subspecialty training in family planning, and PPOSBC has 9 health centers in 2 counties and sees approximately 180,000 patient visits per year. In my position, I supervise clinical staff and assure compliance with protocols and development of patient care programs. As a Planned Parenthood medical director and also as a clinician, I have a unique opportunity to see the impact of contraception on both individual patients and a population of women in 2 counties. In the past year, over half of our patients have chosen birth control pills, patches, or rings as their primary birth control method. An additional 20% of our patients are choosing long-acting methods like IUDs or implants. In providing a year's supply of pills to those patients who choose them, and more effective and longer-term methods like IUDs and implants to those who prefer those methods, we have seen an overall decrease of over 10% in our abortion numbers in the past year. This is consistent with changes that are occurring on the national level. It's also consistent with the UCSF study that was published in 2011 analyzing the FPAC program that showed a potential to decrease the odds of abortion by almost half by providing a year's supply of pills. Those same researchers also demonstrated in a 2006 analysis of the FPAC program that it costs $99 more per patient to provide a 3-month supply of pills than to provide a year's supply, due to increased costs in visits and pregnancy tests, and their research also accounted for pill wastage, which was not significant. These findings highlight a very simple truth. The more frequently a woman needs to refill her birth control method, the more likely she is to experience a lapse in continued birth control coverage. I see this happen with many of the patients I see every week who tell me they got pregnant when they ran out of pills. For example, last week I saw Tracy. She was 24 and she became pregnant for the first time when she ran out of rings and could not get back to a pharmacy in time to get them. She used a condom, but it failed. Every week, I hear at least 3 or 4 women's stories about running out of hormonal contraception and becoming pregnant. There are many reasons why, because their insurance lapsed, they couldn't get an appointment in time with their primary care doctor, they couldn't get a new doctor to write a prescription without an exam, or they just couldn't balance everything in their lives in order to get to a pharmacy in time to get a refill. Women are motivated to avoid getting pregnant, especially when barriers to accessing birth control methods don't exist. And when provided a year's supply at one time, issues such as storage and wastage of contraception aren't common problems on a population level. This is my experience at PPOSBC. It's also reflected in the data from the Oregon Health Plan, which looked at 50,000 patients receiving pill patches and rings and found that only 1.2% of clients needed additional contraception. Women are easily able to store medications in their refrigerator, as they do so often with other medications like insulin or multivitamins. Many women expertly manage the process of storing breast milk. Women can be trusted to properly store a year's supply of birth control. Women frequently overcome challenges far greater than that. We shouldn't be in the business of barring access to birth control in this great state of California. The research shows the dramatic impact that continued use of contraception has on women's physical, social, and financial well-being. Let's be leaders in helping women to achieve their best possible health. Thank you.
Thank you. We've used up all the appropriate time. I'd like you to go ahead and proceed. If you can just keep it short, but feel free, any other testimony you'd like to give?
Appreciate that. Senator, I'm just here to answer technical questions.
Thank you. Please state your name and position.
Pam Mott with Health Access and Strong Support.
Teresa Stark with Kaiser Permanente. With the amendments that were adopted here today, we are in support of the bill. We'd like to thank the senator and her wonderful staff and sponsor for working with us on the bill, and we're pleased to support today.
Sarah Dickey on behalf of the California Pan-Ethnic Health Network in support.
Dr. Jennifer Shaw, obstetrician gynecologist, family planning specialist at UC Davis in strong support.
Teresa Anderson with California Academy of PAs in support.
Angela Blanchard on behalf of NARAL Pro-Choice California, proud co-sponsors of the bill, here in support.
Kelly Ruxtall, student at UC Davis, in support.
Amy Brown on behalf of the California Academy of Family Physicians in support.
Juan Thomas representing California Medical Association in support.
Chris Rosa on behalf of Bayer in support.
Maya Ingram for the ACLU of California, in support.
Dr. Pratima Gupta with Physicians for Reproductive Health in strong support.
Dr. Mona Patel, practicing pediatrician in Los Angeles, in strong support.
Opposition?
Stephanie Wykins on behalf of the Association of California Life and Health Insurance. First of all, I'd like to thank the author and sponsor. We've had an open dialogue with them as the bill has moved forward. Unfortunately, today we are opposed to the bill. We are concerned about the potential for waste, and the distribution of a 12-month supply may increase what we see in waste of pharmaceuticals. We also believe that there might need to be some more rubric around the physician or provider discretion piece, something that specifically calls out that there is either an initial 30, 60, or 90-day supply granted prior to the 12-month script. We look forward to continuing those conversations, but unfortunately today we are opposed.
And Jennifer Alley with the California Association of Health Plans. I echo the comments made by my colleague, and we are reviewing the amendments that we received this morning, but as of today, we're still in opposition. Thank you.
Thank you. Anyone else? Opposition?
Yeah, John Winger on behalf of America's Health Insurance Plans would also echo the comments of Captain Acklick.
Thank you. Questions? Any questions from the members? Yes, Senator Nguyen.
Thank you, Mr. Chairman. Senator, I appreciate what you're trying to do, but I just want to make sure about two things. One, that we are making sure we're protecting women's health. Two is that we avoid any wasteful costs. And so I appreciate you taking the amendments that these prescriptions would be filled by planned pharmacists. Just a question of clarification. Can you clarify whether doctors or pharmacists can prescribe smaller doses to ensure that the birth control does not have any adverse effects on the patient.
And doctors and pharmacists both have under their jurisdiction the ability to provide less than a 12-month supply for a variety of reasons, including medical. And I went through the protocols just adopted for pharmacists that are quite lengthy and check-off list and very sensitive to asking the important questions that need to be asked before you prescribe a year-long dosage. So I think those protections are in place.
Thank you.
Any other questions? Seeing no questions or comments? Oh, we have a motion by Senator Pan. Would you like to close?
Yes, ask for your aye vote. Thank you.
Thank you.
Be directed at me.
Okay, we're at item number 4, SB 999, due pass as amended appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Hall, aye. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, no. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Currently has 6 to 1. It's enough to get out. We'll place that bill on call. We're going to move on to item number 9, SB 1273, Morlock Crisis Stabilization Units Funding.
Find our list.